Hi, it's Dr. Artis, and this week we're going to be discussing the benefits of regular chiropractic care. Most people haven't even been to a chiropractor, but you got thousands of people that are benefiting from chiropractic care on a regular basis. And for those of you that are not, I don't want you to miss out. So you might want to listen to this video so you can understand and maybe even benefit from some of those things too. Number one thing that most people see a chiropractor for is because they're in pain. Most people associate chiropractic with being in some kind of accident, whether it's a motor vehicle accident or they slip and they fall, and they come in and they want some immediate relief naturally. Well, there's so many more benefits to that, and that's one of the number one reasons people come in is it can help you get out of pain faster sometimes and more naturally without the side effects of pain medications and drugs. I see way too many people that are constantly taking medications to actually combat pain, and all it's doing is minimizing the pain, but it's not really correcting the problem. As a chiropractor, what we do is we actually adjust the vertebrae to put them in the right alignment to reduce overall stress and pressure off the nervous system and the overall body to actually make the body function better. It's just that simple. But some of the other benefits that could be better posture. Once you actually get the vertebrae in alignment, you're going to sit straighter, you're going to stand straighter, your body's going to be able to move and not be stuck in certain positions that actually can create instability. And when that creates instability because you're moving overall segments that don't need to be moved as much, that can create more wear and tear and actually increase the chance of arthritis. So you're slowing down arthritis, you can get pain relief. You can also get better digestion. One of the things that I see a lot of my patients come to me and they tell me, and they'll say, Doc, I didn't mention that, but I've been using the bathroom on a regular basis lately since I've been getting adjusted. And that's for the simple fact that we're, again, removing that pressure off the nervous system, especially in that lumbar spine, the low back, that actually has nerves that go to the colon, the small intestines, the large intestines, the stomach, and all those different things that actually can help move the body along and actually stimulate digestion. And that can be a benefit to actually help you overall. The other thing that can happen here is that you get better sleep. One of the other compliments that I get from patients all the time, I always come and says, Doc, I'm sleeping better. I don't know why, but my body's just functioning better. I'm sleeping better. And I don't know if it's because I'm getting adjusted. Of course it's because you're getting adjusted. Your body is getting used to being in that rhythm. You're getting more out of that sympathetic dominant state. You're getting more in a parasympathetic dominant state, and that's going to increase your overall function. The next thing you're doing too is you're getting a faster recovery from injuries. When you recover faster because the joint is not stuck and inflammation is not sitting on that joint, it could actually speed up that healing process. So when we go through and we can actually adjust a subluxated joint or adjust a joint that's subluxated, especially with ankles and knees, you can actually get that moving. So remove the inflammation and the body can heal. It's just that simple. Improve metabolism. When your body is actually moving the way it should be and you're actually able to move more, you're going to have better metabolism. And that metabolism helps you responsible for you losing weight, for maintaining a healthy weight, and actually also using the bathroom as well, as far as bowel movements and digestion. Now, one of the other things that I get people come in for, and they say, you know what, I got these headaches. Can you help me? I heard chiropractic can help. Yes, especially when you're dealing with the upper cervical part of the spine, which is the neck. Removing that pressure off there could be stuck. That could relieve headaches. That's another benefit. Another benefit could be increased mobility as far as like being able to move. And I'm not talking about just bend and touch your toes. There's certain segments of vertebrae, which you got 24 mobile vertebrae that sometimes get stuck. And when they shift and get stuck, that can actually decrease mobility to that segment or that area of the spine. When you have a decreased movement of an area to a spine, that's what we call a subluxation. That subluxation could actually slow down and start breaking down your body slowly over the course of time. So imagine if that happens for over 10 years. Over 10 years and you're stuck like that, those muscles are going to harden, those ligaments are going to tighten up, and you're going to actually have less mobility, which nobody wants. You want to move more. So that increases flexibility and mobility. The next thing you got is anything is possible when you remove pressure or stress off that nervous system. And that's all chiropractic is really designed to do. The benefits are some of the things I just listed. Again, with better mobility, being out of pain, getting out of pain faster, healing faster. I can go on and on about the things right there, but I just want to show you a few things so that you can understand the benefits of regular chiropractic care. Just because of that happens, we got 3 different types of care in my office. Now, the number one type of care that we have in my office is what we call intensive care. Intensive care is just kind of think about when you think about intensive care in the hospital. You get more attention It's a lot more passive therapies. That's because you're inflamed, you blew out a disc, and we want to reduce the pain, reduce the inflammation, and try to get some kind of movement in there to where you actually can function, just basically to get you out of a health crisis. Second type is what we call corrective care and strengthening care. Corrective care is where we're actually trying to strengthen the body where it's weak at, where it's damaged, start tissue repair, start the body to heal. These are more active therapies to where you're starting to participate more and starting to move. And then thirdly is where I fall in with regular chiropractic care is what we call maintenance care or wellness care. That's insurance does not pay for that. So that is more so a type of care where you're coming in on an as need basis. Usually it's once a week or twice a month, or some people just pay as they go. And they come in and they just get their spine aligned. They get their spine checked first, and then we adjust the segments that are stuck so they can actually benefit and get the moving right there, and they can actually see regular chiropractic care. So you got 3 different ways that you can receive chiropractic care in my office and care with me. But I just wanted to discuss those things so you can understand exactly how that can help you. I hope that helps. I'll see you next time. Peace.